Welcome everyone to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of November 10th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. On this Veterans Day briefing, the backdrop for public health remains one of significant tension. Our briefing today will focus on the gap between federal failure and local strength before we conclude with an important observance of our veterans' health. So we have 4 critical topics on the agenda. First, we must address the immediate human cost of the ongoing federal government shutdown. The latest casualties are not just the furloughed workers, but SNAP benefits that millions of our most vulnerable residents rely on for food and nutrition, and we'll detail the scope of this unfolding crisis. Second, in the absence of stable federal leadership, states are mobilizing, so we'll review significant developments, including the Governor's Public Health Alliance, a new cross-state effort to coordinate policy and bolster public health infrastructure while bypassing Washington, D.C. And third, regardless of the political climate, science moves forward. So we will review some updated evidence published in the New England Journal of Medicine on the effectiveness of COVID, RSV, and flu vaccines for the 25-26 season. Essential critical health data that our leaders need. And finally, in honor of Veterans Day, we'll conclude with a deep dive into veterans' health, including how they receive health care and the unique challenges they face. So let's begin with the immediate crisis, the impact of the shutdown, specifically on SNAP benefits. So as we move into the 6th week of the government shutdown, and with the possibility of it finally ending this week, I wanted to provide an update of the Supplemental Nutrition Assistance Program, or SNAP. Over the past week, there have been a lot of updates and changes around what SNAP benefits will look like for the month of November. If you have felt overwhelmed or confused by all the shifting information, you are not alone. Even here at Roots, we have found it challenging to keep up with all of the changes, court orders, and announcements, and mobilizing surrounding SNAP. Right now, SNAP is in somewhat of a limbo. Some states have already paid out all of their November benefits. Others have only paid out part, and some have not paid out any at all. On top of that, funding sources vary. So some states rely entirely on federal funds, and others, like Virginia and Maryland, have stepped in to use their own state money to keep the program running. And this really highlights something we'll touch on in a few moments, which is the crucial role of state level action during federal failure. And so if all that is not complicated enough, the Trump administration is now instructing states to undo full SNAP payments that were made after a court order had initially required the administration to release full benefits. The directive came after Justice Ketanji Brown Jackson temporarily paused those rulings while an appeals court reviews the administration's request to stop them altogether. So a lot of timing and logistics going on here. On Saturday, the Department of Agriculture sent letters to SNAP directors saying that it now considers those full payments unauthorized. Then, in a filing to federal court on Sunday, the agency argued that states had acted too quickly and released full benefits in error after last week's ruling. This reversal comes as more than 24 states have warned of catastrophic operational disruptions if they are not reimbursed for the benefits that were already authorized. The back and forth continues. Just yesterday, a federal judge in Massachusetts blocked the administration's directive to undo the full SNAP payments, at least for now. But there is some hope on the horizon. The Senate passed the first step of a bipartisan deal on Sunday that could reopen the government within days. This deal would fully fund SNAP through next September. It is important to note, though, that the agreement does not include key demands to extend Obamacare subsidies and prevent premium increases, which is the very issue that sparked the shutdown in the first place. So at this point, it's important to know what's going on locally. Visit your state's website, check for updates from your governor to understand how SNAP is being handled where you live. SNAP serves more than 42 million Americans, about 1 in every 8 people, including a significant number of veterans and military families. Uncertainty surrounding the benefits doesn't just affect policy. This is about families' ability to put food on the table and communities' health overall. There's quite a lot of mobilizing going on in many of our communities across the country. Check your food banks, your local community health centers, your faith-based institutions, and your school districts, who are all coming together in different ways to address this crisis. So times like this, it's critical that we stay informed, look out for one another, continue to act as a community to protect and support those who are most impacted. The necessity for local action is what leads us directly into our next topic, which is the Governor's Public Health Alliance. So in recent weeks, I think we all have to admit that much of the news surrounding public health has been challenging, to say the least, weeks and months. And this has caused concern and, frankly, quite a lot of fatigue in many communities. And so for this next segment, we're going to take a step back from the worry and the uncertainty and focus on something encouraging, which is some genuinely positive news in the world of public health. 15 governors have come together to form the Governor's Public Health Alliance. This is a new nonpartisan coalition dedicated to strengthening public health coordination across the United States. The alliance was formed in response to recent changes at the CDC, including changes to vaccine guidance, as well as funding and staffing cuts. Together, these 15 governors, who represent about 1/3 of the US population, share a common goal, and that is to make sure that public health coordination, preparedness, and innovation continue to thrive across state lines, no matter what challenges arise. The Governor's Public Health Alliance will serve as a central hub for collaboration among governors and their public health leaders. It will help share critical information, align emergency preparedness strategies, and support unified communication during times of crisis. And importantly, this collaboration is not meant to replace existing regional partnerships like ones that we've covered here before, like the Northeast Public Health Collaborative or the West Coast Health Alliance, but rather to complement and connect these efforts. So by linking these efforts, the Alliance will help strengthen our national public health network as a whole, as our federal structures are gutted and seemingly falling apart. Beyond the domestic focus, the Alliance will also act as a unified liaison to the global health community, important since the United States has signaled its withdrawal from the World Health Organization. So it will work with international partners on issues like vaccines and public health policy and regulatory solutions. So we know that global cooperation is essential. Diseases do not respect borders, and our responses must be equally seamless. The Governor's Public Health Alliance represents a renewed commitment to that principle, that when we work together across regions, across party lines, across borders, we build a stronger, healthier, and more resilient nation and world for us all. And this work hinges entirely on sound, science-based guidelines, which leads us to our next topic, which is regarding this recent New England Journal of Medicine analysis. It reflects a rigorous and transparent effort to update and communicate evidence-based findings, especially important right now in light of recent changes to the federal advisory process, which has resulted in confusion, and we've covered a lot on this briefing. This analysis was a systematic review of vaccines licensed in the United States against COVID, RSV, and flu. And it actually took 511 different studies into account. So this is a systematic review and a meta-analysis. So it's looking at all of these different studies that met their criteria for inclusion in the analysis. And compiling data like this is crucial for guiding recommendations, including state-level action. And the findings in this analysis reaffirm several critical points. So first and foremost, immunization significantly reduced the risk of severe illness and hospitalization across populations. And again, this was looking at COVID, flu, and RSV. And even when effectiveness appears modest, like the 50% protection against hospitalization for COVID vaccines in immunocompromised people and influenza vaccines in adults, these numbers still represent major reductions in severe outcomes and align with our long-standing influenza vaccine performance over the past 15 years. So this is important as we think about managing expectations. Also, only rarely were serious adverse events noted, such as myocarditis, so inflammation of the heart, or Guillain-Barré syndrome. These are rare, but it's important to note that the evidence consistently shows that risk of either myocarditis or Guillain-Barré syndrome is much higher, many times higher, after contracting the respective viruses, so COVID or flu, than what we have observed following the vaccination. So in any case, even with these rare serious adverse events, those are more common if you are to contract the virus, and the vaccine obviously prevents against that. The report also highlights that the XBB.1.5 variant of SARS-CoV-2, so the COVID vaccines that were adapted against the XBB.1.5, which was the 2023-2024 formula, continues to show moderate to high protection against hospitalization for all age groups, including older adults, including immunocompromised adults. So this demonstrates that even prior years' formulas continued to offer protection into the subsequent seasons. The protection is lower against newer variants like the JN.1. And so this just reinforces the importance of getting the updated current vaccine. So in our case right now, the current 25-26 vaccine, which has been updated. And this also underscores the need for strain-specific updates, which are to happen annually, which is a strategy that has long been used successfully with influenza. We have also seen major progress in RSV prevention. We reviewed this in some detail in our last briefing, so I've linked that in the post if you want to take a look. But bottom line is that we have maternal immunization, we have protection with monoclonal antibodies for our infants. These have both shown strong effectiveness in preventing RSV-related hospitalizations. Also in adults 60 and up, RSV vaccines are demonstrating high protection as well. Also, the findings in this study further affirm the safety and benefits of vaccination during pregnancy, with COVID and influenza vaccines showing no association with miscarriage or anomalies or stillbirth. And in fact, time and time again, we are seeing that these vaccinations are lowering the risk of preterm birth. And finally, the review found that co-administration of virus vaccines such as COVID, flu, and RSV preserves effectiveness and maintains similar safety to giving them separately. So we can give them on the same day and still get the same effect, and that supports the convenience and efficiency of single visit vaccine strategies, which can definitely improve access and coverage. So this is something for you to keep in mind and for clinicians to keep in mind as well. We don't have to space them out. Some people like to just get it over with. And for people who do want to space it out, we kind of have to weigh that against the likelihood that they will actually come back. So these are things to consider, but the review did find that administering them together gives just as much coverage as well as the safety. So we should not hesitate to do that. So all of this research, I think, underscores a larger message, which is that science-based collaborative public health efforts are working. And when states and leaders and health professionals come together, we can build a stronger and healthier society. And we can ensure that in each state and in every community, we will be better prepared to face future challenges, given the uncertainty we are facing from the federal level. So being that this is a Veterans Day briefing, I want to take a moment to honor and thank all of our veterans. And in that spirit, I want to share a bit about how veterans healthcare works, both for any veteran who might be listening or watching, and for all of us, since it's important to understand the system that serves those who have served us. The Veterans Health Administration is the largest integrated healthcare system in the United States. It provides care at 1,380 healthcare facilities, showing the one here in Oakland. And this includes 170 medical centers and 1,193 outpatient sites, serving 9.1 million enrolled veterans each year. And I will note that I have reviewed studies out of the Veterans Health Administration several times here on the briefing, and that is because it is the largest integrated healthcare system in the United States with a unified medical record. And so we can glean many, many insights from such an integrated system, and we have. And also important to note that if getting an in-person appointment is not possible, Veterans Administration telehealth enables veterans to receive care online, and they have had that system in place for some time as well. And one common misconception is that all veterans automatically get free health care for life. That's not quite the case. Eligibility does depend on a number of factors, but every veteran has the right to apply and receive a written decision about their eligibility and to appeal any decision that they disagree with. So as always, advocacy is key. In general, a veteran may be eligible for VA healthcare benefits if they served in the active military, naval, or air service and were not dishonorably discharged. Current or former members of the reserves or National Guard may also qualify if they were called to active duty under a federal order. Once someone is approved for care, they are placed into one of 8 priority groups, and this helps to ensure that those with the most urgent health needs can get care as quickly as possible. And a veteran's priority group also determines what kind of care they can receive, like whether service-related conditions or non-service-related conditions will be covered, and also what their co-payments might look like if they have any. So even though veterans don't pay a monthly premium for healthcare, some do have co-payments, and these costs can vary depending on income and health status. But it is worth noting that veterans with serious service-related injuries, especially those unable to work because of those injuries, are generally exempt from any co-payments. Again, advocacy may be needed. And I did want to note that veterans face unique and serious health challenges. Chronic diseases like diabetes, heart disease, strokes, cancers, and COPD or emphysema are disproportionately common among veterans compared to non-veterans, even when we adjust for age. Also, mental health concerns are significant. About 43% of veterans experience conditions like post-traumatic stress disorder, depression, or substance use disorders. 1 in 3 veterans has been diagnosed with at least one behavioral health disorder. And despite this high number of diagnoses, data show that less than half of our veterans who are in need of mental health services actually receive them. And less than 1/3 of those are getting proper evidence-based care. And this likely contributes to the tragic fact that between 18 and 22 American veterans die by suicide each day, with our younger veterans age 18 to 44 being at highest risk. In response to this crisis in 2023, the Biden administration announced that veterans in a suicide crisis can now receive free emergency medical care at any VA or private care facility, even if they are not enrolled in the VA system. So if you or a loved one are a veteran who is struggling in this way, please make sure that you are aware of this. And in addition, nearly 50,000 American veterans are unhoused, an absolute travesty, accounting for approximately 12% of the total unhoused adult population. And unfortunately, veterans have a higher likelihood than non-veterans of becoming displaced from their homes, with veterans of African descent remaining significantly overrepresented among unhoused veterans. So Black veterans make up over 1/3 of the unhoused veteran population, although they only comprise about 14%. of the overall veteran population. So more than double disproportionate representation among unhoused veterans. And of course, our unhoused veterans are facing the same challenges as other non-veteran unhoused individuals, along with their service-related health and other issues. So as we honor veterans, it is vital to remember the sacrifices they've made and the ongoing health challenges they face, and sometimes the difficulty accessing the resources they may need. So whether through the VA or community-based resources, supporting our veterans means ensuring access to comprehensive health care, behavioral health services, and social supports, and being informed about veterans' health care and advocating for their needs. And fostering community support is just one small but important way that we can all contribute to the well-being of those who have sacrificed and stood in the line of duty. So as we honor our veterans and as we continue to navigate very turbulent times here in the United States, let us remember our best practices to keep ourselves, our loved ones, and our communities as safe as possible. Remember that we take care of one another. It is important that we stay informed with accurate, factual information and guard ourselves against misinformation and disinformation. Let's also remember that we are heading into flu and RSV season, and unfortunately, it is always COVID season as well. So our best defenses there remain. Keep yourself protected if you are traveling, if you are in crowded areas, or you just want that added layer of protection. A well-fitted filtration mask like an N95 or KN95 is an excellent layer of protection. Also, remember your age and situation appropriate vaccinations. So now is the time if you have not received this year's updated vaccines, or if you are someone who should be getting RSV. Also, if you are someone who should be treated, if you do get COVID or flu, then early detection is especially important, so you can get that treatment started as soon as possible. The earlier, the better with antiviral treatments for COVID and flu. And make a treatment plan ahead of time so that you are not scrambling after you're sick and you don't feel well. And so in order to make that happen, of course, if you don't have a primary care provider, please get one. Know how to reach them before you need them. And finally, prioritize your core wellness. Eat a balanced diet, get some good physical activity and fresh air, manage those stress levels, and get some restorative sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we will see you again next Tuesday at 10 a.m.